Hello everybody, my name is Dr. Elsa Arribas. I am a professor with diagnostic radiology in the Department of Breast Imaging with the University of Texas at MD Anderson Cancer Center. And I am going to be having a conversation with my colleague, Dr. Lumarie Santiago, also a professor of diagnostic radiology with the Department of Breast Imaging in the University of Texas MD Anderson Cancer Center. We will be discussing our work with 3D printing in breast cancer and its impact on patient decisional conflict that was published in the Journal of Surgical Oncology in April 2021. It was titled Acceptability of 3D Printed Breast Models and Their Impact on the Decisional Conflict of Breast Cancer Patients, a Feasibility Study. It has been shown that participation in the decision-making process is associated with a lower likelihood of patient dissatisfaction and regret. Factors that influence patient regret following surgery include the quality of the patient-physician communication and the quantity of information regarding the available treatment options and possible adverse effects. Our goal in the study was to create a personalized 3D printed breast model from the patient's diagnostic breast MRI that visualized their cancer and then show it to the patient at the time of their surgical consultation and evaluate their acceptability and the impact on treatment-related decision conflict.
So Elsa, you mentioned that your goal was to create 3D printed models of your patients. How do these 3D printed models help patients visualize their disease?
So as a three-dimensional object created from the diagnostic imaging, the patients can actually interact with the model, visualizing the location and size of their tumor with respect to their breast. For example, here we have a breast model. In here, you can see that we've made the skin in a clear color, and then the chest wall is a brown or reddish tone. When you open the model, inside, you will see the actual tumor, which is in yellow. This is the pre-chemotherapy tumor. We also, in this case, created a post-chemotherapy tumor, here shown in orange. So by looking at this model, both the pre-chemotherapy and the post-chemotherapy tumor, this allows for easy visualization of the tumor response for the patient.
Elsa, thank you so much for that demonstration. But I have another question. In your work, did the 3D printed model help patients have more fruitful conversations with their physicians?
And you know, that's an actually great question, because in our study, the 3D printed model was rated as excellent or good in the acceptability categories, including the ability of the 3D model to encourage discussion. So it's very important for us that this 3D model actually brought about more in-depth conversations about the disease and all of their treatment for the patients.
A diagnosis of breast cancer can be a difficult one that brings about a lot of different emotions. How do patients' emotions influence their treatment selection, and how does the 3D printed breast model influence that process?
Yes, well, you know, patients, they incorporate their values, right? Possible fears, anxiety in the decision-making process when faced with a life-altering diagnosis. In this case, we're talking about breast cancer. So factors that influence that process also include like how well informed they feel about their disease and possible treatment outcomes, and then how effective they feel in the decision-making. Our study also demonstrated a significant reduction in the overall decisional conflict scores following the review of the 3D model by the patient in consultation with their surgeon. This was particularly so in the areas of information, uncertainty, effective decision-making, and value-based decision-making.
What about the radiologists that do not have access to 3D printing? How can they use their conventional breast imaging to help their patients understand their disease and treatment options?
So I believe that a collaborative approach between the radiologists, the breast surgeons, and the oncologists is key in order to properly convey the information regarding the patient's disease as identified in their imaging. Better understanding will allow them to review the 2D imaging with the patients and encourage better communication while discussing treatment options.
Elsa, one final question. What is the impact of 3D printed breast models in the care of breast cancer patients?
So the use of personalized 3D printed models aid patient-physician communication and help convey difficult to visualize information regarding their disease, therefore facilitating understanding of their treatment options and decreasing decisional conflict.
Thank you so much, Elsa, for answering those questions and reviewing this study.
Thank you so much, Lumarie, for being here with me, and thank you everybody for listening and watching, and hopefully you'll find this information helpful. Thank you so much.